When you took over as state's attorney, give our listeners a look at what you walked into in terms of behavioral health in our community.
Yeah, I became state attorney in 2013. I was elected November 2012. And this was at the height of the corruption in the drug treatment industry, where the federal laws, well-intended, the Affordable Care Act, the Americans with Disabilities Act, were being exploited by bad actors to do people harm. Because local governments didn't have the ability to effectively regulate or certify or inspect sober homes, because the Americans with Disabilities Act was interpreted to prevent that from happening, then it was a free-for-all. And all these bad actors came to our community to open up these flop houses. So people would come down to our community trying to get well and instead leave in an ambulance or a body bag.
That's right.
And then you had the Affordable Care Act, again, providing behavioral health care to millions of Americans who otherwise wouldn't have it. And what happened there? Well, unintended consequences when you have a generous insurance reimbursement system where there is no limitation on the number of times you can go through rehab. There's no limitation on the number of times you can go through drug treatment in a lifetime or a year. And the reimbursement's on a fee-for-service basis, old school fee-for-service, which incentivizes relapse. Now, for the Hanleys of the world, it doesn't matter. I mean, you guys are going to provide the highest levels of care. But for a rogue provider who sees these patients as commodities, as people to exploit for money, well, they are incentivized to keep them in an unending series of relapses where failure is rewarded over sobriety.